Hi, everybody. It's Karen Anderson here with Aortic Hope, and we are here for our week in review. If you're not familiar with what the week in review is, it's basically us reviewing the week. How's that for an explanation? Now it's us going over all of the posts that we put up so that the rest of you who might not be on Facebook have an opportunity to kind of like hear our posts, banter with me, give me your thoughts, your questions, your whatever. But we don't only go live just for the weekend review. We go live when we have special guest speakers. We go live when we have really special individuals out there who want to share their survivor story live. And they want an opportunity to interact with all of you. So before we get started, please click like. That's super important. Please click subscribe and click that bell so that you're notified every time that we go live so you don't miss phenomenal opportunities like this. Right, Joshua? Right, Karen?
Right, Karen.
Good. Thank you. Thank you. All right, Len, if you're here, hop on, let us know. We'd love to chat with you. All right, let's get started. We're going to talk about our Medical Monday post. So if you've been diagnosed with an aortic aneurysm, you might have a ton of questions, some concerns about this condition and your treatment options. And here are some questions that really will help you ask your physician, help you communicate about this condition, help you understand what's going on when it comes to your situation. So one of the first things you should ask is, what is an aortic aneurysm, right? Let's understand what it is and what actually causes it. That might help you get a better sense of, I think as humans, one of the first things we say to ourselves is, did I cause this? Did I, eat something really bad and now I've caused this situation that I'm trying to understand? So it's important for you to understand that probably this is hereditary and maybe you've just had the bad genes and it's just something that was going to happen, and for whatever reason it got turned on. It could be that you didn't know you had high blood pressure. I mean, because so many people walk around and they just don't know, and that was a contributing factor. So asking, explain to me, what is it, and and how did I get it, I think will really start that conversation going a lot easier. I think it's also important to ask, how big is this aneurysm and where is it located? Now, when you ask the question about how big is the aneurysm, you're asking something that you don't really understand what that means in relation to your actual overall aorta. So remember that you're going to hear a number, and I think it's very common for all of us just to hear this arbitrary number and get a little nervous. So I'll give you an example. So I didn't have that opportunity because I had a dissection, but not too long ago, I had a cardiac catheterization, and they came back and they said, "Oh, your vessels are great, your heart is great. You have a 40% blockage in your coronary artery, and everything's fine." And I went stone cold white because 40% kind of sounds a little big to me. But then they explained to me, I'm 54, it took you 54 years to get to this point of it being 40%, and we don't intervene till it hits 80%. So technically, I suppose if I implemented no changes, it could take me another 54 years, right, to get to the 80%. But I had to kind of understand, how do they even make that judgment? They just kind of eyeball it, and they're so used to seeing this every day because this is what they do as interventional radiologists, and that they come up with that number. And if they say it's not a big deal and the cardiologist says it's really, you're fine, and the thoracic surgeon says, hey, it all looks great, then I just let it go that it's great. Who am I to decide that 40% sounds large? I mean, if I ate 40% of a cake in one sitting, that might be considered a lot. But when it comes to my health, sometimes you just have to defer to the judgment of the physicians and just let that part go. So when you hear how big your aneurysm is, it doesn't really mean it's big. It could just mean, you know what, compared to what you're, based upon your size, your age, your body frame, what that size of your aorta should be statistically, you're, at the larger end of normal or just outside of that range. Just take it lightly, grain of salt. It's more important to understand, how are you going to monitor it and what your potential next steps would be when you hit a certain measurement. And that could take forever. It could take, I mean, think about when you find out what size your aneurysm is and you're this age, think how long it took for that to form. No one knows. Did it form in the last year? Did it form over the last 20 years? So you really need to kind of focus in on, okay, I have this aneurysm. So now what can I do to kind of prevent it from growing? What's the things I can do to be in control over my health as best as possible? Kind of like me and the coronary artery situation. So I think it's also really important that you ask about what are the signs and symptoms of a rupture or a dissection, because I know that's going to be a really big concern for everyone out there when they find out they have an aneurysm. What would lend me to go to the ER? So that's a wide range of questions and answers that are going to fall in there, because it seems to be that individuals that find out they have an aneurysm all of a sudden start feeling things that they may or may not have felt before, such as I'm short, I have shortness of breath. I'm having a problem swallowing. I have discomfort in my chest, but maybe you didn't have any of that until you found out you have an aneurysm. So that's where you have to kind of evaluate how you were feeling before diagnosis versus after. And is some of what you're feeling potentially more um, mental in the fact that it's drilled into your brain now that you have it? So are you really feeling this sensation, or are you feeling it because of anxiety, because you know it's there, which would be completely normal, totally normal. uh, and you want to learn what are some of the things that would cause you to have to go to the ER. And I'm not going to be the person that's going to tell you what those are, because your situation is going to be different. But would you go to the ER if you were having really high blood pressure? Should you go to the ER if you pass out? And that's not obviously something that's normal for you. What about chest pain? How long do I wait if it's lingering before I go? These are conversations you have to have with your own physician. And a lot of us learn by going to the ER instinctively, because we just know this feels nerve-wracking, and then we're told, well, you actually have gas, you're okay. Or we're told, I think maybe you pulled a muscle and you're okay. The the likelihood of having a dissection now that you've been diagnosed with an aneurysm is reduced significantly from those of us that didn't even know we had an aneurysm. And that's because now you're going to be followed. Now you're going to be monitored. Now you're on somebody's radar. So uh, I would still want to know what the symptoms are I need to look out for that would cause me to go to an ER, generally speaking. I would not ask about how will I know if it's a dissection, um, as much as what causes me to go to the ER, because everybody feels dissections differently. There is no one definition of what you're going to feel. If I said to you, you're going to feel ripping and tearing in your chest, but maybe you just feel dizzy and, like you have reflux, that might not cause you to go to the ER when really you should, because maybe that was the moment that something's happening. So at the end of the day, again, talk to your physician and find out, is there anything that would cause me to have to go to the ER to make sure that everything's okay? And what would those feel like? Also, you might want to ask, how often do I have to have this aneurysm checked and monitored? And what would those tests be? I know a lot of people in the community feel that CT scan is the only way that you can get an accurate measurement, and that is simply untrue. Just untrue. It's not true. Echoes are one way that you can have an aneurysm in the thoracic area monitored. Now, really, the echoes, I think, are probably used more for taking a look at your valve. They do produce a measurement of certain areas in the thoracic area of your chest, but a CT scan is going to be your golden test, right? But that's because it's fast and it is accurate. You can get in and get out. The problem is that it does include radiation and a specific dye that there are many people that are allergic to the dye, so they have to be pre-medicated. And the alternative would be an MRI, which does have a different type of dye. It's called gadolinium, but that's typically tolerated by the majority of people. It's just that that test takes a lot longer. It can take about half hour, 40 minutes to do the entire aorta, your chest, your abdomen, and your pelvic area. It's still going to produce a really good picture. Now, here's the clincher. When you have these tests done, I also see in the community a lot of people will want to know, why are there varying differences in numbers? Did the radiologist get it wrong? Did the echo that said I was at 4.2, but the CT scan that says I'm at 4.1? Who's telling the truth? Who's getting the errors? What does this mean? You know what it means? Let your doctor read it and tell you what the total number is. That's my best advice. That's the best advice. Not because radiologists don't know how to read it, but some don't read it the right way. So you have to imagine on your echo, you're trying to read something that is like in 2D, it's flat. So if you try to measure a tubular structure that's flat, and if you measure it diagonally, it's going to be a different measurement than straight across. It just is. And some of the measurements that they give you are actually the length of the aneurysm, and people think it's the width and they freak out. Don't freak out. Don't freak out. Don't freak out. Wait until your doctor tells you this is your measurement, if it's important for you to know. Some people are good with, you're good, we'll see you in a year. I would not be good with that. I would want to know a measurement because I'm kind of fanatical like that. But then when you've got your MRI or your CT, that's a different way of measuring also. Now, your surgeon should look at your scans and they're going to measure it the exact same way all the time. Technicians doing echoes or doing CTs, the technician A, between that person and technician B, might measure it differently. Some are from the inside points of the aorta, or one is the inside and one's the outside, or they're measuring outside to outside. There is a standard way of measuring these tests. In addition, if you're having a test done at a different facility than you did the last time, that could yield a different result. In addition, if you have a CT scan and one was gated, which means they've got some electrodes on you to determine your heart rate. I mean, not your heart rate, your heartbeat, to make sure they take a picture. I think it's in between beats versus having a test that isn't gated and you're comparing apples to bananas, it's not going to necessarily give you the same result. So the rule of thumb that you can control is make sure you have your tests done in the same location over and over and over again. And you might not be able to guarantee you have the same uh, technician reading it, radiologist reading it. But again, at the end of the day, you just need to wait to hear from your physician to tell you if there's been a change or not. That's the most important thing. If you are somebody that needs to be tested every 6 months, with CT scans, there's nothing wrong with asking your doctor, well, could I maybe move to an MRI where I don't have to have so much radiation? That's a fair question. And they're going to tell you you're not really receiving that much radiation. But for certain people, for certain circumstances, any radiation is concerning. And that's okay. Have that conversation, right? Mm, but if you're asked to have an echo, it probably means that you have an ascending, a thoracic ascending, aortic aneurysm, and this gives them a chance to take a look at your valve to see if that aneurysm is impacting the valve at all. So that's one of the reasons why they may have you have an echo. But just ask what kind of test you're going to have and ask how often, and trust that process. Okay,
Hold on.
what are the risks? Oh, yeah.
Before I let you go, I just want to say we had in the support group somebody who was diagnosed with an aneurysm, and
Hmm.
he was a cardiologist that kind of found it, and was like, yeah, we'll give you a scan in 2 years, and the flares
Hmm.
from the support group, the alarm on everybody's face,
Oh, yeah.
like everybody was like, well, hold on a second.
Yeah.
And this
Yep.
gentleman is in his like early mid 40s,
Hmm.
and it's like I just don't feel comfortable with that. I feel like second opinion time, start swinging for the fences,
Yep.
self advocacy
Right.
for
First
sure.
thing I would do is I probably would say to my physician, I'm not feeling comfortable with that. I would prefer to have a follow-up test in a year. Let me see what it's doing in a year. And so the interesting thing is you can go a year, but it grew in 3 months, and you still won't know till you have the test done. But you can't have it. You have to have a reason to warrant a test every 3 to 6 months. If there's no growth, they are going to want to push it out. So, but I don't think I could ever live with waiting. 2 years. I don't even like waiting 2 years on a colonoscopy, just because I'm so used to having so many Crohn's issues that the first time I heard they wanted to go 5, it just took my breath away. Um, so, and that's why probably it created some issues because then I got nervous and then I ended up having one sooner than later. But again, if a good team of doctors is going to listen to what you have to say and weigh in on your requests. Will you get another one in 3 months? Probably no, because there's no reason. There's been no growth that anybody can determine. But I would not personally want to wait 2 years. No.
And that's what
I'd
we all
ask for
said.
one.
That's what we all said.
Yeah.
We were like, you know what?
I can hear you all doing that. You can hear it. That's just terrible. All right. So, what are the risk factors for aneurysm growth or rupture, and how can I reduce them? And that is an interesting question. I'd love to hear those answers if you ask them, uh, because really the risk factor for aneurysm growth is typically, uh, one, it's going to be genetics. Because at the end of the day, this is just a human body. We can't really control everything our bodies decide to do. If you could, you wouldn't have had the aneurysm to begin with. So it's going to be genetics are going to play a role. Two, it's going to be your blood pressure control. It's going to be, are you bearing down or straining or lifting heavy weights and holding your breath as you do that, or any kind of exercise, really? So you'll find all of that out from your physician, and you should ask that question, as far as, do I have any restrictions too? That could help eliminate the chance for growth. And that's part of your how you can reduce them. Treatment options. So there's a lot of different treatment options for aneurysms, but it depends on where the aneurysm is and if it's impacting your valve or not. So you want to ask, when the time comes, if this grows and it needs to be treated beyond the medication treatment that I might be prescribed now, what would be some of the other ways that we could fix this? I know everybody who finds out I have an aneurysm, it's 4.2, 4.4. I just want to get it fixed. I wish the world worked like that. It doesn't, unless you have certain connective tissue disorder, then it might work in your favor and you might be able to have it fixed. But these are hard surgeries. They're not easy. And so a physician typically wants to wait, because statistically, waiting is still your better option, and you intervene when you are literally at the point and you have no choice. Counterintuitive. I hate it too. I know that you all hate this also, but that's kind of the way that it works based on statistics. So when you are going to have surgery, if it's open, they're going to do it at a time where, okay, now we need to do it. So if you're living with symptoms, if you have any, that they're going to push this to the last minute. But find out what the treatment options might be for you. Maybe you are a candidate for something endovascular. Uh, but that is a good question to ask. Uh, when you're getting to the place where you think you're going to need a procedure, probably sooner than later, then you want to ask about how you can prepare for the procedure, if it's open heart or if it's endovascular, and what you can expect as far as recovery, and what you can expect before it and after it. And what does recovery look like? And what will follow up care look like? I can tell you follow up care is going to be involving continuing monitoring. That's what's going to be like for the rest of your life. And how will having an aortic aneurysm affect your lifestyle, your diet, your exercise, your work, any additional medications? So, from what I remember, especially after talking with the disability attorneys, aortic aneurysm in and of itself is not a cause for going out on disability, unless you have a job where you have to lift 150, 200 pounds every single day for hours on time. And that's what you're lifting. You have to be able to lift a person if you're in a certain medical career. I would assume that maybe that could be problematic. Maybe you're lifting luggage to get it in and out of a plane. And that could be problematic because, some of you ladies have really heavy luggage. I know I'm one of them. So there might be certain careers where having an aneurysm now has impacted your ability to fulfill the job requirements based on your restrictions. That doesn't mean you go out on disability. It means you hope your employer is one that can help find you suitable position in your workplace. It might mean finding another career path, doing something else. So there's probably special cases where an aneurysm has been cause for disability, but it's not something that generally happens like a dissection does. So it will probably impact your lifestyle a little bit. They're probably not going to want you to do like martial arts or football unless it's flag football. They're probably not going to want you to do, you know, competitive weightlifting, stuff like that. And if that's something that you're really into, something that they want to put a restriction on, you really need to have a conversation with that physician and see if you guys can work together to find ways to compromise, to retain the lifestyle that's going to bring you joy. Because there's nothing worse than having something taken away and now you're literally doing nothing. Well, that's not going to help the situation. That's going to create more stress, anxiety, depression, all not good things for your body systems. Would diet help? Diet always helps. Diet, diet, diet. We're always told about that. So it's going to probably be low sodium, if not, zero, if you can do that. And, obviously your fatty foods and greasy foods, all that's going to try to go bye-bye because that really does impact your heart before it would impact your aorta, although aortas can have some calcium deposits as well. But I would find out that information. Don't go all crazy like I'm going to cold turkey change everything because it's not going to be sustained, right? So make incremental changes and have a support system help you do that. And there are ways to alter your exercise so that you are accommodating your new health situation, but also accommodating what makes you happy. So these are some of the questions that you should be able to ask your physician to learn more about your aortic aneurysm. And it also changes depending on where it's located. You have the right to ask any questions that you have to get clear and honest answers from your healthcare team. Don't ever hesitate doing that. If you're in a situation where you're not comfortable, it's time to go find another team. And that's your Medical Monday.
Excellent. Diane joined us in the chat.
Excellent.
Hi, Diane.
Hi, Diane.
She says
Our
she's
technical
been fighting
difficulties.
with logging on, but she wrote it as loving, so I thought that was adorable. And then she said, grandkids had the phone all weekend. TikTok and videos is all out of whack. Even my home screen changed.
Yeah. Oh my gosh, time to get a new phone and lock it.
Right.
All right. We're going to go on to Topic Tuesday. And so I think this was still written by Adam, our third year med student. So hoping that you're
and you are
staying.
going to read every one of the beautiful words he writes. No live editorializing because you feel like he's being too friendly. It starts with
Oh no.
"What's up, family?" exclamation point.
All right. Quote, "What's up, family?" How's that? All right. Adam hopes you are all doing well and staying warm during this cold surge over the country, which I felt like it went away for a couple days and then it came right back. But be sure to bundle up. Get yourself a nice hot cocoa and spend some time with your loved ones whenever you can. It's good for the soul, so it must be good for the heart. So if you were with us last year, then you know that we reviewed a bit of anatomy, aortic anatomy and zones, which we did. We talked about a lot of different zones, and it's actually in Aortic Dissection, the patient guide. So let's bring back our weekly quizzes that we put in place here. Without peeking, let's see if you remember this. Which zone, there's 8 of them, 1 through 8, of the aorta contains the renal arteries? Let me think about this. I'm gonna guess 6. What do you guess?
I want to say that there was 7.
You
Oh, no,
think
no,
it's
wait, wait,
7?
wait. No, 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 wait. I heard the question wrong. So, which
I
zone
thought
contain the renal arteries? 8.
you think it's 8?
It's got to be.
No,
I
because I
don't
think
know.
the
What
8
would I
goes
know?
no. I think 8 goes into the iliac, but we'll find out. Hopefully, he gives us the answer because I don't remember right now. But for this week's post,
No, no, no. Yeah, I think you're right.
I wanted to talk a little bit about something I do not believe we ever touched about before, and we had not, and that's called myocarditis. Okay. Maybe some of you have heard about it, but there is a link that Adam included from the Mayo Clinic, which has so much great information about myocarditis. But let's talk about this. So, a myocarditis, I believe, is another fancy word for a heart attack. So, this is your heart muscle. This is what it looks like. Here's a cross section. Bonk. Close up, this is what your heart muscle or myocardium looks like up close. And this is a myote, a heart cell. Myocarditis is inflamed heart muscle. Okay, I'm still, could be right. I'm still waiting, but it's an inflamed heart muscle. Here's damaged myocyte or heart cell, and here's inflammatory immune cells. Let's review some of the anatomy to paint a clear picture. Okay, so you have the heart. The outer layer is called the pericardium, and it consists of 2 thin fibrous protective layer that contains fluid to protect them from friction, so they're not rubbing against each other, these 2 layers. And then you have a layer inside. You see that orange layer? That's the myocardium. It is the middle layer that contains the heart muscle. And then deep inside is the innermost layer. That's the endocardium, and it actually lines the inside of the heart. So the heart consists of these three layers that we just talked about. Pericardium, again, is the fibrous covering of the heart that helps protect the heart. The myocardium is the middle layer, which consists of a majority of the heart's dense muscle tissue. And the endocardium is the most internal layer of the heart that lines it. And so myocarditis refers to an inflammation of the myocardium or middle muscular layer of the heart with symptoms that includes fever, chest pain, shortness of breath, and palpitations. So I'm thinking I was probably wrong. Sounds like it's an infection, right? Or inflammation. Additionally, because much of the heart's contractile or pumping function depends on the myocardial layer, severe myocarditis can cause heart failure-like symptoms, including swelling of the lower extremities and difficulty breathing when you lie flat due to fluid in the lungs. There's several potential causes of myocarditis, including an infection, could be viral or bacterial, certain medications that your body is just too sensitive to, such as certain antibiotics, can cause myocarditis, chemicals such as radiation or carbon dioxide, and inflammatory diseases such as lupus or arteritis. Butchering a word, but arteritis sounds about right. All right, so when you're experiencing myocarditis, it can be incredibly stressful experience because most cases often resolve on their own without any persisting side effects or cardiac damage. But severe cases could lead to a persisting heart failure or permanent damage to the heart and its conduction system. So here's an example. We have normal heart muscle, normal myocardium. I don't know why, like I feel like my mouth is full of marbles, and normal myocardium heart muscle. Here's when it becomes inflamed. So you've got these inflammatory immune cells in here attacking your normal heart muscle, and it becomes inflamed. Look at that. Look how big and thick. It's thick and it's swollen, and it impacts the heart muscle when you have myocarditis. So to help protect yourself against the risk of myocarditis, it's good to practice to avoid activities that can get you sick. So wearing a mask will help you not get sick. Avoiding close contact with people who have cold-like symptoms or other infections. If you're sick, be sure to do the right thing and avoid exposing others too, because you could create myocarditis in them. So wash your hands regularly and avoid risky behaviors that can get you sick, such as unprotected sexual activity and the use of non-prescription drugs. If you or a loved one ever had a severe reaction or allergy to a medication, be sure to let your healthcare provider know if you're being prescribed any medications. So again, if you've ever had a severe reaction to medication, it's important to let your physicians know because as we heard above, certain antibiotics and medications can cause myocarditis. So additionally, stay up to date on your recommended vaccines, including flu, rubella, COVID-19 viruses, all which can cause myocarditis. And that's it for this week. Be sure to take care of yourselves and your loved ones. Until next time, let's remember to think aorta with warmest regards from Adam.
He does such a great job.
Myocarditis. Blah, 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 blah. I feel like I need to relax my mouth from saying myocarditis too many times. Let's move on. We're moving on. I'm curious now because I'm curious now for people in our community who have lupus before the dissection if they've ever experienced myocarditis. I'm just curious.
Yeah, and also another thing that I would like to have seen was, it goes away on its own, but what's that time frame look like,
Yeah.
right?
Yeah.
And I bet
And
you it's
why?
different for everyone, which is why it's probably not
Yeah,
in the article. But it
probably.
would be interesting to find out if it's like, you get diagnosed with myocarditis and, 17 weeks, 17 months,
Yeah,
somewhere. Just an
sure.
idea for how long you might have to
7 days?
endure.
Like, I don't
Yeah,
know. Right. And do you need like, can you just take oral medications? Is this like, do you need a PIC line to like get the medications directly to the heart? I'm curious.
very curious.
I
Yeah.
don't know.
We have
Right.
questions,
All
Adam.
right. All right. We do. All right. So February is a really, 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 really busy month. It's Black History Month. It's Heart Health Awareness Month, including Heart Valve Awareness Day and Marfan Awareness, all fall in the month of February. So let's start first with Black History Month and let's celebrate African American innovators in cardiology as outlined in Children's Hospital in Pennsylvania. For years, African American cardiologists have broken through barriers and confronted stereotypes while making critical contributions to the medical field. In celebration of Black History Month, we're highlighting a few of these incredible innovators and the impact they've made on the lives and health of millions. You got to check out this list. See, in the past, we we really were only finding articles on a lot of doctors that were, I mean, you're talking early 1900s. Um, and now there's a huge list of really innovative cardiologists, and you just need to click that list, and you'll see all the individuals' names in the past, in the present, of people of Black cardiologists who have really contributed to their field. So I suggest you click the list and check it out. Okay, let's move on to what was our first Friday fundraiser. You know, you like this graphic. I did good on this graphic. All right. Aortic Hope belt covers. You want to get them now because in March, we have to have a little bit of a recommended donation increase. We're just covering the costs. Postage has gone up. Oh my gosh. You know, when I think about what a stamp cost when I was younger, for those of you that don't know what stamps are, that's how you mail things in that metal bin outside of your home. It's called a mailbox. And I look at how much stamps are now. It's no wonder people want to just email everything. Crazy. Packages cost a lot of money, but you can still get a yep, it's one of those days. It's one of those days.
You are
You can get a
killing it.
help belt seatbelt cover. You can get one now if you're in the United States for $15 donation and international for 20. So you get your choice, and they're pretty awesome. They come in red, they come in black, they come in yellow. And what's great is these belts don't only have to go on your seatbelt. They don't. We have discovered that they're great on the leash of your dog. When you're taking your dog for a walk, what if something happened? You know, now you've got this belt cover that is bright. It is reflective. Inside, there's actually a card that's in a plastic area of the back of the belt where you can put. I've got one of the cards here they come with too. Your allergies, your medical contacts, your emergency contacts, medical conditions, prescription medications, your personal, religious, or cultural preferences if you're going to be treated, and any notes so that a first responder, they're going to know based upon that medical icon right here, they're going to know to go and check this out. They've already been made aware from the person who creates these belts. They're going to go inside, they're going to read your information, and they're going to have a better sense how to jump on this condition. So you can wrap it on the bar of your bike when you go biking. You can put it on your backpack if you're going for a hike. There's so many different things you can do with this. And we were always talking about it as a seatbelt cover. It's just a belt cover. It's a bar cover. It's a cover. It's a cover, and it's a way to feel safe and that you are being covered. So you get your choice between yellow, black, and red. They're eye-catching. They're 9x2, all your important information. And we have the following offerings. We have abdominal aortic aneurysm, thoracic aortic aneurysm, aortic dissection, medic alert, Loeys-Dietz syndrome, vascular Ehlers-Danlos, Marfan syndrome, and now we've added pacemaker and blood thinners. So we've got 10 belts, and you can also request some in French or in Spanish, and we can get those made for you as well. So you just have to order. In March, it's going to go up to $18 and $23. So I requested donation. First Friday fundraiser. There you go. All right, we're moving on to Saturday. It is our Survivor Series Saturday. And look, the community, they want to hear from you. We started this because we wanted to tell our stories. And then we were like, well, we want to hear somebody else's story. We want you to be the shining star in someone's life by sharing your story of survival, sharing your loved one's story of survival, or if you lost a loved one or a friend to aortic disease, it's equally important to share that experience with all of the community as well. If you are somebody who has survived or you are a caregiver, we want to kind of know what your symptoms were that you were experiencing. How did you get diagnosed with aortic disease? What were you feeling if you had a dissection? Did you feel anything that led you to be diagnosed to have aortic disease or an aneurysm or heart valve issues? We want to know what your experience was if you went to the emergency room, because if you were misdiagnosed or underdiagnosed, we want to share that with Think Aorta US so that we can start educating these first responders and emergency room physicians to not do that anymore, to think aorta, two simple words. And so by sharing your story, it really does help promote the awareness campaign with that organization. And so if you're interested in sharing your story, You can do so one of three ways. You can send it to us in a written format, include a photo. You can do it as a pre-recorded video, include a photo. And you can go live with us where you can take questions and interact with the community as well. And that we would also ask that we get a photo so we can properly, promote this. So that's the information. Again, when you hear survivor stories, your takeaway should be that you feel a sense of validation that, wow, somebody else had something similar to myself. You might come away with some really interesting talking points, and it might make you want to have a conversation with your physician to engage and learn a little bit more about your own personal condition. And if you're the person sharing, we hope that you come away feeling that it had some therapeutic benefit to you to share, to engage, to know that you're creating awareness and hope and providing support to others by just sharing your story. And that is our Survivor Series Saturday.
I want all
Okay.
of your stories. I want all of them.
We all want all of them. All of them. Even if you're sitting there and you're thinking, it's not much of a story. That's just to you. You don't get to choose if I think it's not much of a story. You'd be surprised to know that it is a great story. All right, we're moving on and reminding you about our collaboration with Lawrence Hope. See this? Lawrence Hope has such amazing products, and we're going to talk about this a little bit. So, as important as it would be to have a help belt or a help uh, item to have you feel protected when you're riding your bike, taking your hike, walking your dog, riding in the car, whatever the case may be. It's also important to consider wearing a medical ID bracelet or dog tag around your neck or what have you. This is really also going to be another way to let a first responder know that there's a medical situation because, again, it has that medical alert icon, that symbol that's it's acknowledged, it's understood, it's accepted by the community, and then they will have an idea on how to treat your emergency accordingly. Lawrence Hope is always offering discounts. However, when you make a purchase using the link that we have highlighted on our website, we're going to actually receive a portion of the sales. And 100% of the money that we receive from this company is used towards our initiatives within the community. One of the things I want to tell you about Lawrence Hope also is that it's not just pretty, sparkly jewelry. Why do I do this when it's sparkly, pretty? It's sporty. It's waterproof. It can be high tech looking. There's so many incredible options, and they offer a free shopping service. So you can call their customer service and tell them, hey, I'm looking for something that is, a hypoallergenic and, um, something I can use every day. It'll go with all kinds of different things. I would like it to be more for athletic, whatever you want to tell them. And they're going to show you the product line that's going to best meet your needs. In addition, because they've been working so closely with us here at Aortic Hope, they've kind of become really in tune with the acronyms that the emergency first responders accept on the back of the bracelets, like on the emergency cards that are behind the belts. On the back of these ID tags on your bracelets, you have usually 5 to 7 lines to put information about yourself. So obviously you want to put your name. You can put your in case of emergency contact or your ICE. You can put your allergy or ALLGY, however that they're using that acronym, anything that you're allergic to, IV contrast. If you write out all of these words, it's going to take up too much space. So they know how to condense them for you. So yes, if you have to have a blood pressure on a certain arm, you can write that down too. If you're taking blood thinners, these are super important things that need to be told to a first responder. And they will help you figure out how to basically create the back of your ID tag. I don't want to say bracelet because it could be dog tag. So it's your ID tag. So you do want to call customer service and they will love working with you. They're so friendly, they're so professional, and they're so knowledgeable. And I feel confident you'll walk away with a product that you're going to feel very secure wearing. And so that is our reminder of our collaboration with Lawrence Hope. Okay. Phew.
Hi,
Vent's page
Velda.
keeps growing. Velda. Hi, Velda.
She's stuck in 6-foot snowdrifts.
Oh, yeah. You stay there, Velda. I thought it was bad here. It's 37 and cold. And I'm like, I want to be in any 6-foot snowdrifts. No. Mm-mm.
Crazy what's
I don't want
happening
any
up
more
there.
snow. All right, February is very, very busy. So busy. So today is the 7th. Okay, we had our support group meeting earlier. We did our weekend review today. Tomorrow begins our kickoff of our Aortic kitchen with Chef Rob Seltzer and his wife, nutritionist Mindy Seltzer. And they are starting at 3 p.m., moving forward on every other Wednesday. And so, what they're going to do is really exciting because they're going to have a conversation about different aspects of nutrition in the aortic community and then do a cooking demonstration. And if you are on Facebook and you are part of Aortic Hope's private forum, which all of you should be, there are a lot of new files of all kinds of really great nutritious recipes that Chef Rob has put up for us so that we can use. And I'm sure he would love to know how it worked out for all of us cooking some of his recipes. So join us. Join us here. That's why you got to click that subscribe button. That's why you got to click the bell so that you are reminded when you forget that tomorrow at 3 o'clock Eastern, Chef Rob and his wife Mindy will be on teaching us, educating us, and cooking something wonderful for us to watch and try ourselves. All right. Then on Thursday, we always have our Aorta Hangout at 2 p.m. Eastern, led by Rob and Mindy. And this is really not a support group meeting, although you have to sign up for it using our support group registration form. This is truly just a hangout. It is a, you know, no holds barred, whatever goes on happens, kind of online partying or relaxing, whatever. From what I've been told, people will make dinner, people will just have a drink, people might fold laundry. They're doing whatever they're doing, taking a walk by the beach and just wanting to hang out with like-minded people, and just not necessarily be so heavy in trying to solve the world's problems. They just want to hang out. So if that's what you're looking for with some people who have something very similar to you, then join us on a hangout. You just, again, need to fill out the support group registration form once and you'll be notified when the support group meetings happen and when the hangouts are happening. Then we have February's, it's our second session for this month of Qigong with community member and aortic dissection survivor Kevin Songer, who also started Aortic Dissection Life and Cardiovascular Health. I hope I'm remembering that page correctly. But he will be doing this every Thursday through the month of February, continuing adding on to his series of Qigong. If you don't click the subscribe button with the bell, you're going to miss it, but you can always come back here and review it later. But click the bell so you can be part and you can chat and ask questions. All right. Then we have our Valentine's Day bingo, which is closed. It's not going to be here on YouTube, but we love doing bingo. It's going to be 10 games. It's free, and you have an opportunity to win all kinds of prizes. And you get one card. You have to register. Even if you've registered and played with us before, you have to register again. You'll get one bingo card printed off. Use that card over and over again for all of the 10 games. What are some of the other things that we have that are out of the ordinary? Well, we do have our caregivers only support group meeting. Our second session of the month comes up on the 17th of February, which is a Saturday at 10 a.m. We are adding in this week, Thursday, the 15th at 4 p.m. Eastern, just giving you a heads up. I am interviewing Kim McNicholas. I'm not even going to tell you anything about her right now. Suffice it to say, when you see this information go up, you're going to want to be part of this live event. This woman had her achievements, basically her resume is just incredible. She's won an Emmy for her journalism, and she was a contributor to Forbes. She's been on CNN. She's been featured on Fox. What she did in her documentary, which she'll tell you about, is amazing. What she turned her passion into in her own nonprofit for peripheral artery disease is incredible. And her own personal experience with aortic disease is heartbreaking and yet also very inspirational and educational. So we're going to have her here, and she's going to share all this information with the community at 4 p.m. on the 15th. Let's see. We also have, I'm just pulling out the things that are not typical, like bringing Ben Udelman, Dr. Ben Udelman, cardiothoracic surgeon of Maimonides Medical Center and founder of Aortic Bridge, which is more of a grassroots, smaller nonprofit based out of Brooklyn, New York. He will be with us on the 20th at 7 p.m., taking all of your questions and answering your questions about anything aortic related. We're going to talk about a lot of different things. And I think, we also have another live event on, I believe it's the 27th. which we are getting ready to pull up, and that will be, I think it's at 6:30 p.m. with Dr. Diana Milowitz. Jack Crow from Aortic Athletes will be conducting this interview. I know it seems like it's not typical for Jack, who focuses a lot of his interviews around aortic disease and exercise. This time we're taking it to a molecular genetic level, and we're going to talk to Dr. Milowitz about her thoughts and her experience and her work with genetics and how it plays a role in determining um, some of these guidelines when it comes to exercise and aortic disease. She's also been working at a UT Houston where Dr. Prakash has been performing all of these research studies surrounding exercise and aortic disease. So this is be a great time to have some higher level information about genetics and have a chance to ask her questions. So that's coming up, and that will be put up as well soon in the next 24 hours for the 27th. I think it's at 6:30. Don't quote me. I think maybe could be, not sure. There's a lot. February's big, but it's a big month. There's so much happening, right? Yeah,
It's a
heart
leap year.
awareness. Well, that's what it is. That's what happened. That's why we have extra things. It's too many days in February. Oh man. Oh man. Oh man. All right. That's what we got going on. And because it's Heart Month, because we're going to have because we're acknowledging Black History Month, because we're acknowledging Marfan awareness, heart health awareness, heart valve awareness, we're going to do a few giveaways here on the next couple Mondays. Who's coming up? Is it me? who's going live coming up on the 12th? It's Tammy. Yeah, so Tammy's doing it on the 12th, and she's doing it on
19th.
the 19th. Yeah. So, yeah, you got to join in. You got to comment in order to win. We've got a couple new things. I'm sure you guys have seen where we have car decals now, window clings, because we know that these awareness magnets are incredible. They've been with us now since like 2017 or 18, but these new cars are having problems with things sticking to them.
Yeah,
That's like you're limited with the gas cap, right? The gas tank or the bumper.
Tam was so cute about it. She's like, I've been thinking about a cling for years now. Nothing sticks to my car.
I know. And now we have a cling, and it's great. It's like 2x6. It's a nice, decent sized cling, and you can get those with a $5 donation. But hang out with us, and maybe you'll get one for free. I don't
Right
know.
on. That's what we want to hear.
Maybe. So got to join in. Got to make a comment. Hang with us for the hour. You can do it. Look, today's not even an hour. We're close. Hang with us, and then maybe you'll win a window cling. All right, everybody. Tammy will be with you next for the next 2 weeks on Monday at 3 p.m. I'm going to see you throughout this month because there's so many activities happening. Don't forget to click like. Don't forget to click subscribe and the bell, or you're going to miss all these great things that are taking place. And thank you so much to Velda and to Diane for hopping on. Thank you, Joshua. We will see you. And hey, Melissa. Sorry, missed that. Thanks, Melissa. All right. We'll talk to you guys soon. Take care.